Welcome to the presentation on knee wrapping and taping. This is generally for knee sprains or hyperextensions. So basics, you wrap or tape the knee for either support of an old injury, protection of a new injury. So this could be sprains to the inside of the knee, which is the MCL, the outside of the knee, which is the LCL, or the internal ligaments, which are the ACL and the PCL. You could also wrap or tape the knee for hyperextension, which protects the whole backside of the knee. Now when you tape the knee, you're actually going to want it weight bearing. So you're going to want the patient standing. You want the knee in partial flexion, so partially bent, and you do want them to actually have weight in it. Now the best thing to do is actually put a roll of tape or a book that's about an inch or two high under their heel, have them step forward so that the knee you're going to tape is ahead of the other leg, and then have some weight in it so that you have some muscle contraction in both the quads, in the thigh, and in the calf muscle. So first I'm going to cover wrapping the knee, and then we'll go into taping the knee. It's the same process, you're just using different materials. Now you remember from taping the ankle that we use the figure 8. And the figure 8 is what we're going to use with the knee as well. The point to remember is that the X in the center of the 8 goes over the painful area or the area you want to protect. So what I'm going to demonstrate in the pictures and the video will be wrapping for the inside of the knee, so for an MCL sprain. But you can easily move the X to the outside or to the back of the knee for other injuries. So you're going to start with the tensor on the quad or up on the front of the thigh. Okay. You're going to wrap downwards, crossing the inside of the knee and back towards the back of the calf. Just like with elastic tape, you want to take about half of the stretch out of the tensor. You're going to cross around behind the calf and come back up, crossing the first strip you went down by the knee. Okay, so you've now created an X here. You have one loop that goes around the lower leg and one loop that comes up around the thigh. You wrap back around behind the thigh, meeting the starting point. So you're going to continue to follow the same pattern. You go down, around the back of the calf, up the front, cross, back around the thigh, and back. And you just continue to do this same process around and around until you run out of tensor. When you run out of tensor, you're going to need a piece of white tape to hold it in place. It might need to be a longer piece of tape depending on what they're going to do with it. Now to tape the knee, you're going to do the same process and the same pattern. You're going to use elastic tape, okay? And it's up to you if you want to put Pro Wrap underneath. You do have to make sure if you put the Pro Wrap underneath that you still have tape at the bottom of the 8 and at the top of the figure 8 that are touching the skin. If you don't, it's all just going to ravel down and become a big mess at the knee. Okay, so you do have to have tape that actually touches the skin in order to hold everything in place. So if you're going to do Pro Wrap, you're simply wrapping all the way around the knee, okay, and that's going to protect the skin from the elastic tape. So you're starting with the elastic tape up at the top, just like where you started the tensor. You're going to cross down on the inside of the knee, wrap around the back of the calf, and come back up, crossing where you were, coming back around to meet where you started. Just like with the tensor, you're going to take half the stretch out of the elastic tape as you wrap. Okay. Once you come back around to where you were, you continue on with the same process, okay, the same figure 8 pattern. You do not rip the elastic tape in between. Okay, you just wrap continuously. Once you've done 2 to 3 complete figure 8s, then you can rip the tape, and then you're going to put some anchors on with your white tape. Okay, just like what we did with the Achilles tendon wrap, you need to anchor the elastic tape to make sure it doesn't unravel on itself. So I'm going to walk through the video of this being live so that you can see how it's done. So again, we have them weight bearing, heel up on something, we wrap the tensor around, cross back ahead, wrap around, cross back, and back up to where you started. And you just continue this process, taking half of the stretch out of the tensor until you're done the wrap. Okay. Once you're done, doesn't matter where you end, you grab your white tape, and you're going to hold that in place. Now this, if this was all we were going to do, we'd put more tape on, but because we're showing you the wrapping over top with the tape, we don't need to. So same process, down and cross. Notice how it touches the skin, up and around, down, around the calf, up, around the thigh, and we're going to end there. So there's just a wrap coming across the top. White tape to secure it. Okay. And it's all good there. So considerations, remember the X needs to be in the center of the figure 8, and that needs to be at the point of pain or discomfort. So if the pain is on the outside, where the white arrow is here, that's where you want your X to be. If the pain is on the inside, we did the MCL, but if it's on the ACL or the PCL inside here, you actually don't want to be right on the inside. You want to be a little bit closer to the kneecap. Okay, so where this red arrow is a really good place to put that X. The one thing you do need to watch for is that you're not coming right across the kneecap. That'll be quite painful for the person when they bend and straighten their knee. So your X might be a little bit lower, just depending on their knee anatomy. When you're doing hyperextension, so they have pain when their leg straightens fully, you want the X right in the back, in the center of their knee. So important notes, with these ones where you're using either a tensor bandage wrap or elastic tape, if the tape job is too tight, they're going to feel like they're getting a calf in either their quad or their calf. Okay, what you need to do is then have less pull on the tensor or the elastic tape so that there's more elasticity within the tape on their leg. You can play with how many wraps you do and the strength of pull, and that creates the best tape job for each person. Some people might like it really tight with lots of wraps. Some people might like it looser with not so many. Okay? You do need to ensure the tape is removed when your activity is done. They'll need to do some stretching, possibly some icing, but tensor bandages and elastic tape have that elastic piece to them. So if you leave them on, they will and can get tighter and tighter and tighter. So you want those removed after activity is done. And again, we don't want them to sleep with any tape or tensor bandages on an injured area. So next up is hip wrapping and taping, and that'll be followed by finger taping. For more information on healthy living or to see my other courses, check out thehealingpath.com.